नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोकैर्जरारुभय मृत्युनाशम् धातारमीशं विविधौषधीनाम्.
I'm going to talk about the impact of Panchakarma, or what is the role of Panchakarma in the preservation and promotion of health, particularly considering the modern lifestyle. Everybody knows that prolonged exposure to the modified lifestyle what we are living means everybody is not doing this thing, but in my opinion 70 to 80% of the population is indulging this, that is excessive use of alcohol or smoking or unhealthy diet or inactivity, means not doing exercise, or particularly stress. And stress, nobody is considering in the forefront, but in my opinion, throughout the practice, I have found that maximum impact of stress is there on the health, rather than this smoking or unhealthy diet and alcohol. It is there, but very few people are having impact due to that, because many of them have a good genetic makeup and all these things are there. They survive, or there is less impact. But stress has a very strong impact on the body, so that also we have to consider here. And due to that, chronic diseases like heart disease, stroke, diabetes mellitus, metabolic syndrome, chronic obstructive pulmonary disease, and all the non-communicable diseases and number of diseases we can count, and autoimmune disorders takes place due to this lifestyle. It is not necessary that you are indulging all the misbehave or mismanagement, like somebody is taking the diet which is not proper for a longer duration, then it will have a different impact. Only that diet. If somebody is not having a good sleep at night for a long time, then that will have an impact. If somebody is taking alcohol in the bigger dose for a longer time, it will have a different impact. So everybody has a different impact, and earlier or later they land in some of the non-communicable disease. And according to UN, by 2030, the proportion of the total global death due to this chronic diseases is expected to increase to 70%, huge 70% by 2030. We have just entered in that decade, and the global burden of disease, particularly non-communicable diseases, will be 56%. So look at this. If we can manage these diseases just by the lifestyle, just by the Panchakarma, can we imagine what will be the impact on the society? And it is our duty, particularly the Ayurveda physicians and Ayurveda practitioners who knows that Ayurveda can manage all these things without medicine, and just by following good lifestyle, good diet and Panchakarma, we can change this scenario. So health and health determinants, that is holistic determinants, health and health determinants, that is holistic approach which encompasses all elements required for healthy living. Holistic approach is, people think that just following the herbals and certain traditional system of medicine, it is a holistic approach. No. Integration of all the system. Actually, in my opinion, the pathy or the system or therapy is not important. Important is a person, a human being. What is most suitable to the person who is in need, who is ill, or who wants the promotion and preservation of the health? What is the best for him that should be provided to him or her, and that is their right, despite of the from what pathy or from what system or from what country or from the which culture it is coming. It is immaterial in my opinion, and that should be there, and everybody should have a equal opportunity to get this knowledge. And it is our moral duty to spread this knowledge to the globe, that how beautiful it is. And so integrative approach of all the system, whatever the best in the system should be adapted and should be implemented. And the fusion of that should be done. That is actually, this is the era of the fusion in everything. If you consider the food, if you consider the music, if you consider the clothing or whatever, culture, everywhere fusion is there. Then why not in the health? Why not in the treatment? Why not in the management of the diseases? So health promotion, specific protection by restoration and rehabilitation through Panchakarma and healthy lifestyle is need of our. This is the blueprint for preservation of health, and that is nothing but the Dincharya and Ritucharya described in Ayurveda. Dincharya, simply, many things are there, but I have pointed out certain important notes, that waking up early in the morning. Now, when you read that waking up early in the morning, we just consider, everybody says, even in the rituals also, they says wake up early, and who wakes up early, means many rhymes are there, and makes you wise and happy and healthy and wealthy. So, but nobody takes it seriously. Waking up early morning makes a lot of positive changes in your body, but at this platform, it's not that platform to talk about that, because my topic is Panchakarma, so I won't discuss it here at length. But I think Dr. Vasisht is the best person to talk about what are the benefits of waking up early, because I know every morning at 4 o'clock or 5 o'clock he wakes up, and it has a very positive health impacts, because it is suitable for your biological clock, and it is according to cosmic clock, so that makes a big difference. Then the passing urge of urination and defecation after means early in the morning, regular habit of that makes a big difference in your health. Brushing the teeth, there are many habits. People, I don't say that totally, I do not say that it is wrong, but people have a habit to have a bad tea, or even doing breakfast and everything without brushing the teeth. That has also impact on your health. Then application of anjan, means coryllium in the eye. Then here the Panchakarma enters the nasal instillation of oil, that is nasya. 2 to 4 drops of the warm, simple sesame oil, or whatever oil you have available, or if nothing is there, then clarified butter, that is ghee, or even olive oil, whatever is available oil with you. Just instillation of 2 drops of the oil, warm oil in your nostril. Then the gandush, that oil pulling in the mouth. Now in this corona, these 2 things, nasal instillation of oil in your nostril and oil pulling, has proven a big role in the protection. Because when you instill the oil in your nasal pathway, it coats your mucous membrane, and whatever comes from the outside, it catches over there, and whether it is a bacteria or virus, it does not allow it to go inside into the lungs or into the body. And so it catches it there only, and that protects you. Same way, when you do the gargling, means oil pulling in the mouth, it also helps. Anything enters in the buccal cavity, it do not allow easily to enter in your stomach. So it protects you. Even in the spring season, or if you go outside, if there is no infection in the air, then even many irritants or pollutants are there in the air. You can save yourself from this, putting the oil in your nostril. So that is a really good thing. And actually, Ayurveda has said that there are 15 occasions in a day they have advised you to put this oil in your nostril with different role. Then the chewing of oral freshness, particularly bitter leaf tambul, what we know, pan in India, Indian knows very well. But nowadays, this bitter leaf has changed its nature, whatever you are getting in the market. But ideally, still in the temples, particularly temples of the Krishna, what is being offered to Lord Krishna, that is a tambul according to Ayurveda. They put the clove in it, and then that bitter leaf is taken. Anti-cancerous activities and many more impacts are there with that bitter leaf, if you are taking particularly in the morning, after breakfast, and after lunch also. Then the oil application and body massage, and after that you can have a exercise, and then udvartan. Udvartan is massage with the powder, dry powder, and then have a bath, and then you are ready for your daily activity. So if somebody follow these, it will prevent him from many things, and he will get a robust immunity and physical, mental strength. We will see the clinical proof or evidential proof also in the later slides about this. And then most important is Ritucharya, that is seasonal regime, and particularly in the point of view of the Panchakarma, I will talk today, that in every Vasant Rutu, means in the season of the spring, everybody should undergo the Vaman, that is therapeutic emesis. In every Sharad, in every autumn, one should undergo the Virechan, and in every monsoon, if we perform the Basti, we never ever get disease. Why and how, that we will see in the coming slides. This is about general pathogenesis of lifestyle disorders in Ayurveda. When you don't follow all the rules, you have a less activity, you don't do exercise, high calorie food, and then the disturbed sleep, irregular diet, improper diet, stress is there, all these things are there, then what happens? It accumulates dosha, it accumulates toxins in one way, or you can say humus in your body. And then when when you do any of this thing, it simultaneously do another process of altering the status of your body tissue, like your blood, your fat, or rasa, mansa, what we know. So all the body tissues are being altered. It depends on what you are doing, and it has it's called affiliation with which tissue it is having. With which tissue it is having affiliation, that will impact that tissue. So suppose you are taking a high calorie food, it has a natural affiliation with that meda dhatu, that your fat, and so it will increase the kapha also, and it will simultaneously alter the status of the fat also. And if you continue with that, in the long term, you are going to get disease. How? That symptom of accumulation will occur, and then when that kapha reaches to that meda dhatu, which is already altered status, then there will be a lodging of dosha, and the pathogenesis start to take place, and disease occurs. Now, and that can be whatever, it can be diabetes, or high cholesterol. Suppose, as I said, that high calorie food you are taking and it has altered the status of the fat metabolism. And then if you keep it longer time and you are not doing exercise, then there are chances that you will get diabetes or you will get high cholesterol, and then further on. So likewise, for every disease it happened. But during this process, if you are not following the lifestyle, means Dinucharya or Rutucharya properly, then even if you do Vaman in spring or Virachan in autumn or Basti in the monsoon, this will break this chain by cleansing your body, by throwing out all this increased dosha out of your body and bringing back all this tissue in the order. That it breaks this chain and you will not get the disease. So it is very important that at least one Panchakarma, means or either Vaman or Virachan or Basti, at least once in a year you will do. You are allowing your body to break this chain, and it is saving you to land in any grave disease or non-communicable disease. So Panchakarma is a unique treatment of a modality of Ayurveda, which comprises 5 major therapeutic procedures for internal purification of the body, along with allied procedures. Purification procedures of Panchakarma allows the biological system to return to homeostasis and rejuvenate rapidly. These are the renowned Panchakarma. Panchakarma is a name. Actually, many karma comes along with Panchakarma, but these are the 5 mainly. That is Vaman, that is therapeutic emesis to eliminate kapha. And then the Virachan is the therapeutic purgation to eliminate pitta. Then the Basti is to eliminate aggravated vata, and that is therapeutic enema. Then Nasya, that is therapeutic nasal administration of the drugs, and that is for the diseases of the above clavicle region. And bloodletting, and that is for eliminate aggravated rakta dosha or blood blaze morbidity, that is therapeutic bloodletting. These are some few Panchakarma allied, which are known as allied therapies in Panchakarma, but plays a big role. Everybody is aware about Abhyang, that is oil massage therapy, and then the Shirodhara, which has become a symbol of Ayurveda, a pouring of oil on the forehead, and then the Svedana, that is sweating, or you can sona, or you can say that it is sona or many type of sudation, and then Udvartana, that is powder massage therapy, and Gandush, oil pulling therapy. Even we can say that putting the oil in your ears also comes in this. So these are the global prospect of Panchakarma in the public health. It's a cost-effective management. It's a paradigm shift of health care from curative to preventive therapies and promotive therapies. It's highly efficacious, means high efficacy is there. Results are very good. And then natural bio-cleansing procedure it is. What are the benefits of this cleansing, bio-cleansing or whatever, biopurification which is which is known as a Shodhana in Ayurveda, purification. Shodhana means purification. So it increases your metabolic fire. It increases your metabolism, which is known as Agni in Ayurveda. And once your metabolism is intact, your immunity is intact. And your immunity is intact, you are naturally you are protected by many things. So it's a basic thing, and this Shodhana improves this Agni. Then it increases your intelligence, your strength. It strengthens the sense of organ, means Indriya Mana Atma Samprasada. So it is a matter of feeling. Whomsoever has undergone Virachan or Vaman or Basti, they can say that how they feel. Means it's a matter of perception. When you listen to something, when you perceive something, your thoughts are clear, your perception is very sharp. So these are the impact of this Shodhana, Panchakarma. Then the stability of the tissues, that is the dosha dhatu sthirata. And because, as I told, when you do the mismanagement in your diet, you're not sleeping well, all this thing causes the imbalances in your tissue, and this Panchakarma removes that imbalances and gives the stability to your tissues. And then when you have this all, obviously it will lead to the longevity that provides you dirghayu, longer life. And after Panchakarma, if you take Rasayana treatment like Chyawanprash or something Guruchi Rasayan or Amlaki Rasayan, it really helps you to live longer without disease. So it helps in prevention. It helps, means particularly if you go for the seasonal Panchakarma like Vaman Virechan and Basti, or even the everyday like Pratimars Nasya or oil pulling or head massage like thing, then it is having a curative aspect also, but that is not the area today we have. It is very effective in non-communicable diseases and restorative also, particularly after the bad lifestyle, or if you have diseases like hemiplegia and all these things. Panchakarma is really effective in all the neurological conditions. We'll just have an idea about how Vaman, Virechan and Basti are effective. Vaman is, as I told, it is a therapeutic emesis, and it is usually done in the spring season, means during March and April. It is spring in India, or it can in the northern part of the world. It is a little bit later. It starts in April, May. So in the spring, there is a natural, provocation of kapha is there, because sun becomes a little bit shiny and becomes strong, and it increases the kapha in the body. And to remove that kapha, Vamana is the best. And if Vamana is done in those times, particularly we listen that in the spring season that there is allergic problems like asthma and urticaria and eczema and all these things aggravates. If we do Vaman in every Vasant, in every spring, we can save people from this thing. And many more diseases which are related to kapha, like obesity, anorexia, indigestion, hyperacidity, migraine, sinusitis, rhinitis, allergic bronchitis, overweight, dyslipidemia, and diabetes mellitus, and list is long. So if Vaman only is taken once in a spring, that can save you from all this thing. I will share certain data or evidence with you how much effective it is. It increases, this is the study done by the Naik and Rao in 2019, and that is, it has mentioned that it increases glucocorticoid, increases catecholamine, increases CTH, and increases heart rate and vasodilation. It's a prevent autoimmune and anti-inflammatory condition. It has been showed in that study that it decreases, Vaman decreases anti-streptolizin O, that is ASLO titer, and it suggests that Vaman is definite answer for autoimmune disorders. Then at the Jamnagar also, we have conducted one study of the Vaman. What we did is we conducted 4 samples at a different time of the Vaman, and we saw the impact of the Vaman on the lipid peroxidation. Lipid peroxidation is refers to oxidative degradation of lipids, and it is responsible for atherosclerosis and aggravates the initial tissue injury. And catalase is a protective enzyme, and it prevent the accumulation of toxic level of hydrogen peroxide formed as a byproduct of metabolic process. And we found that when we started Vaman, you can see that in the sample one, catalyzed activity was up to 36 and it reached up to the 50 at the end of the fourth sample. Means catalyzed activity increase, significantly, where the lipid peroxidase reaction was decreased significantly in all the four sample. So started from the 7, it came up 8, came up to 2. So itself is suggests that how useful or how important to take woman or give woman, and how it is having impact on your body. It increases your catalytic activity and it decrease the lipid peroxidase reaction in your body. Then the viration. Viration is the purgation, and it is usually given in the Sharad, and that is people consider it as a simple cleansing of lower intestine and intestine. It is not like that. When you are taking ghee, it has a big impact on your body. It prepares your body to remove the toxin from each and every cell of your body. It comes to your stomach, and then there is a mechanism. Purgation is a simply cleansing of the intestine, but viration is not. When you give ghee, as I told, your toxin of your body assimilates in the ghee, and when you do there is for 7 days you take ghee, and then for 3 days there is a sudation and massage. During this period, all this toxin mingled in the ghee comes to your stomach, and then on the 10th day you give the medicine which throws out all this toxin from your body through the purgation. So that is the difference between the purgation and the therapeutic viration. And there are studies that suggest that it lowers the hepatic glucose production, helps to prevent elevated blood sugar, and most important thing is which is a very new thing today, and that theory has proven also, that is this microbiome. When you give viration, it changes whole environment of your intestine, of small intestine and large intestine. So it changes the set of the microbiome. And after that, when you give the samsarjanakram, means particular diet, particularly gruel of the rice, and gradually going to the protein like green gram soup, and then we give the meat soup or khichdi, that is a mixture of rice and pulses mixed with the ghee or fat. So gradual exposure to carbohydrate, then the protein to the fat, that provides a person a new set of microbiome in his or her intestine, and that changes the scenario. Then the Basti, there are 2 types of Basti. That is one with the main ingredients are decoction, and one is with the oil. Even the Basti with the oil is given regularly, which is known as the Matra Basti in the small quantity. There are the studies that Mustadiyapan Basti is seen to reduce the tuberculosis specific IgG and IgM. That means it is having impact on the immunity. And Matra Basti, particularly oil Basti, have it influences the immune function of the body by production of T leukocytes, kinase, modulation of lymph mechanism. This is the published paper I have quoted over here, and then it suggests this thing. So Basti has a very vast impact, having a vast impact on your body. Particularly, it is a very well-known theory that enteric nervous system of the GIT has connection with the central nervous system via vagus, and ENS works in synergism with the CNS, and it is proven in the diseases. Stimulation of the ENS also stimulate the CNS, and that's why in the paralysis and all other conditions where the pathogenesis is somewhere in the CNS, but when you give the Basti or you give viration, there is a great impact on the patient, and they recovers from all these diseases. And there are many more diseases like that that in asthma also, if you give Virachan, you have a greater impact. Very good results are there. So, and it is, in my opinion, through the gut microbiome also it is happening, because when you change the microbiome of the intestine, or it might be strengthening the good microbiome in the intestine, and thus it is helping the secretion of the enzymes in the positive way, and which stimulates the central nervous system, and that's how it might be working. Many studies are that Basti have a very good impact on CNS through ENS. This is the study which we conducted at Jamnagar on the Genomic by Virachan and Basti. The sample were collected at Jamnagar and were analyzed at Institute of Genomic and Integrative Biology of CSIR at New Delhi. Sample were collected Jamnagar. 60 patients were selected randomly for Basti and Virachan, and 10 patients selected in each group for gene expression, considering the cost. And the samples were collected and sent to the Delhi. And this is the process which was adapted for the collection of the sample, and data from these images were analyzed to determine SNP genotypes using Illumina Genome Studio gene expression module. And you can see, I am also not a technical person to explain all these things, but because I was involved in the study a little bit, I have understand. And this is the picture where the red dots are there. You can see these red dots says that some genes are expressed in different ways. Some upregulating and some downregulating genes were expressed differently after Basti. So some around 120 genes were downregulated, and some around 125 genes were upregulated by Basti. And by Virachan also, the same impact was there on the genes. And total 26 genes were upregulated, and that 61 genes, 26 genes were downregulated, and 61 genes were upregulated by Virachan. And that also has been noticed, that which genes were upregulated and which were downregulated. By the Virachan, genes related to compensate the damage caused by reactive oxygen species and inflammation resulting after ischemic attack were upregulated. Then the prevention of added infection by helping the formation of another defense line. Then the triggers robust immune responses related gene, that is cytosol DNA sensing pathway, was also upregulated. And then hematopoietic stem cell lineage, that is neuroprotection and reduction in the post-ischemic inflammation, that was also upregulated. Means it control all these things through genomics. And these are some pathways which were downregulated, that restoration of the calcium ions, reinstating and brain homeostasis, then the prevention of the further development of pathological changes in brain tissue and prevent further damage due to stroke. That gene was downregulated, that pathway was downregulated. Then the cellular senescence, maintenance of the integrity of blood-brain barrier was also gene related to that, was also downregulated. And ameliorate atherosclerosis causes a profound reduction in plasma cortisol. That gene was also downregulated by Virachan. In the same way, these are the genes upregulated by Basti related to upliftment of the immune system, potent boost to immune system, neuroprotection, and anti-stress effect genes were upregulated. And reactive oxygen species, reducing the level of osteoprotectegenerin and the high inflammatory responses, related to inflammation and regulation of the apoptosis and preventing cell death. All these pathways were down-regulated by Basti. So it shows that Virechan and Basti is having impact on the genes also. Epigenetic responses also can be reversed or changed by the Panchakarma. This is a big thing. And if you have damaged your body by the improper lifestyle, that also can be reversed and you can be protected by Panchakarma. This is evident of that, and it is really a wonderful thing. Many studies still are going on to find out how it works and what the impact it is having on the gut microbiome, particularly this Panchakarma. And once all these studies will finished, I think very miraculous result will come out, and it will, in my opinion, what I believe is it may change the paradigm of the modern system of medicine to look at the diseases and to look at the management of the diseases. That potency Panchakarma is having. Certain karma, we have talked about Vaman, Virechan and Basti. Certain karmas which are being done regularly in Panchakarma, that is massage, everybody knows. And there are many studies, it helps in the decreased anxiety and cortisol decreases. It increases blood flow and lymphatic flow, increases blood flow, then relief in the symptoms like pain, sleeplessness and fatigue. Particularly, it is very good for the inducing the sleep. So in insomnia, massage can be the best thing. Even it increases your immunity also. Ayurveda has says that if you do massage regularly, it increases your longevity, and many more benefits are there. So intervention of Panchakarma for prevention of disease, particularly for the maintenance of the good health, is a daily nasal drops you should put, as I told, the Pratimarsnasya, then massage, then type of powder massage, then head massage, and according to season, the Vaman and Virechan and Basti. These are some evident about the Pada Abhyang, that is foot massage. Foot massage, if you regular practicing with sesame oil, is very beneficial for reducing eye strain. Study shows that on a visual analog scale for severity of symptoms and Likert scale for measuring frequency of the symptoms, marked improvement was observed in both the assessment criteria, particularly through the foot massage. So it is very good for eyesight. Then for scalp massage, Shiro Abhyang, you are putting oil on the head massage every day. It also means these are the two clinical studies which shows that after the treatment there were more patients having continuous sleep, and duration of sleep increased by 6 to 7 hours with the this massage in the head, and positive effects were observed on the stress hormone, blood pressure and heart rate. Therefore, scalp massage can be used for the stress control with no special or time limit. Means every day it is a part of, particularly in the southern India, it is a part of culture that every day every person put the hair in the oil and there is a scalp massage. It is having a very good impact on our body. It improves generalized, it gives the benefit in generalized body ache. It improves indigestion, it removes vertigo, and it also removes the heaviness of head. So there are many benefits of this simple head massage. Due to constraint of the time, I am not going in the methodology of all this paper. I am just going through the results. Then the Shirodhara, which is known as pouring of the oil on your head, forehead, and the scalp. And this Shirodhara has many studies has been done on the Shirodhara, but this is the one study I would like to quote, that It says that significant improvement in the mood scores and in the level of the stress. And then these changes were accompanied by significant decrease in rate of breathing and reduction in diastolic blood pressure, along with reduction in heart rate. The relaxed altered state after Shirodhara was correlated with an increase in alpha rhythm in EEG. Means it brings your mind at peace, your body at peace. A standardized Shirodhara leads to a state of alert calmness similar to the relaxation response observed in meditation. Means whatever the benefit you are getting in the meditation, you can similar benefits achieve from the Shirodhara. So many people are not able to go to the meditation. They are not, for them, might not be possible. They are not able to control their mind. They can do Shirodhara at the regular intervals, and there are the lot benefits they can get from this, like meditation. Then head massage again relieve the stress of patient, felt comfortable in all symptoms presented with the mean gradation of anxiety reduction, which was statistically significant. So for anxiety also, for the restlessness, for fear, for depression, and blood pressure, this simple head massage is a very effective way to control it. It costs nothing, simple little bits warm sesame oil, and you apply on your scalp, or if you have a medicated oil, that can have a best impact. And that these results were just achieved in the 7 sittings only. So if somebody do it regularly, it prevents them from the stress and all this depression and more many things. Then this is about the Abhyang, means massage, or body massage by the oil. And already we have discussed it is effective on the stress and psychological parameters. Then this Pratimarsnasya, nasal instillation of oil in small quantity, means 2 to 4 drops in each nostril, little bit warm. And it may be useful not only to control progression of the disease, particularly in generalized anxiety disorder. This study was done, that Pratimarsnasya of Anutel and Brahmitel was given in 54 subjects. And it was not only useful in the controlling the progression of the disease, but it can also pave the way for effective and non-invasive techniques in the treatment of generalized anxiety disorder. It improved it at significant level in both the group. So for anxiety, even Pratimarsnasya, which has been, they have told that every day we should put in our nostril. As I told, you can save yourself from getting the infection through the nasal route. That is the side benefit. These are the main benefits of that. And then the powder massage, also very useful to shine your skin, glow your skin, to open your pores of the skin. But this is the side benefit, that it controls your weight also. The weight was significantly reduced by 3 kg by just doing Udvartanam, is powder massage, for 7 days. So if somebody is doing regularly, then definitely it will control the weight. And of course, it opens all your channels, particularly or the spores. Your skin breathes in a better way. And there are many benefits. So these were some evidential proof I tried to share with our learned participants who has joined today with us, that what Panchakarma can do if it is adapted in our regular lifestyle in a systemic manner. We can, save the society from the many diseases. We can promote the health, prevent the health, and the burden of the non-communicable diseases can be, reduced significantly if the Panchakarma, particularly in the Dincharya and the Tucharya, means in your daily lifestyle and in your seasonal lifestyle, if it is adapted. So primordial, primary prevention, curative and promotive aspects should be given emphasis through Panchakarma, should focus on comprehensive and all inclusive healthcare of the community. An evidence-based approach in Ayurveda through Panchakarma will lead to global revolution in public healthcare. I believe, and I strongly believe that Panchakarma definitely is going to change the scenario of healthcare system one fine day, when the people will come to know the benefits of Panchakarma. And I wish and I pray that those days come very soon. Thank you very much.